It's such a beautifully cloudy day. Just look at this. It's so beautiful. Today we are going to talk about medical book recommendations. So it's either for readers turned into medical students who want to pursue their passion for reading again, or medical students who want to start reading about something but they do not want to stray too far from their area of studying. There are a lot of good books out there. These are just three amongst the many. I don't have the third one. The first book is by 𝕣𝕚𝕚𝕟𝕜, A Surgeon's Notes on an Imperfect Science. It offers a realistic idea of the surgical field, the highs and lows of the profession. So this is for those who want to get an idea about what it's like to be a surgeon before actually deciding to become a surgeon. It is full of anecdotes and reflections from his experience. It is divided into three sections. The first is fallibility, medical errors and misadventures. The second section consists of mystery, which talks about cases that perplex even the whole medical profession. Like, for example, I think it had a bit about something about blushing, how they're not able to explain it. I don't remember it exactly because I read it a long time back. But yeah, that was something that was really interesting. And complaints like nausea, vomiting, pain, which are so generalized that you have to do a proper, thorough workup of the patient to diagnose it correctly. Otherwise, you'll be going off in the wrong direction and treating in the wrong direction. The most striking thing about this book is the willingness of the author to confront the reality of the field. Surgery is a very messy branch, not just in terms of wounds and dressings, but surgery is a ethically messy branch as well, and that doesn't get talked about much. These conversations happen only inside the profession, surgeon to surgeon only. So if you want to get like an inside scoop of what goes in the experience of becoming a surgeon, then this book is for you. Most surgeons have had to make very difficult decisions in their lives that would be too overwhelming to sit and think about. Even if in a case a commonly performed surgery, there is a very anticipated error, some mistake that might not be due to the surgeon's negligence. It is an anticipated error. It is also a forgivable error. Like if you are performing 100 surgeries, some of them are bound to get wrong, not because of you, not because of the thing, but maybe because of the specific situation of the patient, and maybe not even because of that, due to sheer chance. Who suffers for that? If you want to continue being a surgeon, you have to be accepting of your mistake. Not everyone leaves the table. Doesn't mean you don't try your best. You try your absolute best, but some things are bound to go wrong, and you have to have that acceptance within yourself. Then only you will be able to sleep at night and live with yourself. Of course, I'm not denying or lessening the patient's condition, but we can extend an empathetic hand towards the surgeons as well, because they also have to live with the consequences of their actions, their decisions, their mistakes, and that too on the top of an already demanding and sometimes a soul-sucking residency program. This book and this profession is not for the soft of the heart. It will leave you questioning the very nature of modern healthcare system. It's very honest. The next book is Every Patient Tells a Story. The subtitle is Medical Mysteries and the Art of Diagnosis. Yes, that is it. That's the description of the book, The Art of Diagnosis. This book is for people who are interested in core internal medicine. And I would say this Rakesh Nair, who I absolutely love, he made me fall in love with medicine. I think a lot of people as well. He made a lot of people fall in love with medicine. I love the way he thinks, and I would love to meet him one day. Anyway, this is the sort of a book that I think he would approve of. It shows the importance of listening to the patient. It is a blend of medical expertise and narrative storytelling. This is beautifully written. At the start of your medicine career as a medical student, you sometimes forget to see the patient as a human, and you see them as a constellation of symptoms that you're trying to fit into a certain pattern. That's what sometimes ends up happening in history taking. This book reminds you of the human element of the patient. A must read for a medical student of any year, because we are taught history taking from the first year itself, I think second, and then again in third, and then again in the final year, and then again in internship, and that goes into the residency as well. Every patient, every case is so unique that all your previous knowledge is tested as well as questioned. So you have to be up and ready with an open mind to think about every presentation of every disease. I read it last year during my medicine posting. That's one more thing you can do, is you can read the surgery wala book during your surgery postings and this medicine wala book during your medicine postings. That would add a beautiful, I don't know, kind of an side aesthetic to that posting going on, and as you're studying the theory portion and the practical part and everything. This can be a beautiful supplementation to the books that you're already reading. The introduction is titled Every Patient's Nightmare. It describes about, what happens when you have a complaint and you go to one doctor, they're not able to diagnose it, you go to another doctor, you go to another doctor, you keep being referred, not diagnosed. You have all these tests going on, and that's an absolute nightmare, right? Because without a diagnosis, you cannot move forward with the management part, right? Any management without a proper diagnosis would just be supportive. Anyone who has enjoyed the cluster of medical shows that we have, like House MD, The Good Doctor, Grey's Anatomy, The Resident, anyone who has ever enjoyed them, this book is for you. Because just like in those things, that a patient presents and nobody is able to diagnose it, there's not a straightforward diagnosis, but then someone notices the KF ring in the eye and suddenly it's Wilson's, and then they start the treatment. If you've enjoyed shows like that, then this book is for you. Actually, the author of this book, Lisa Sanders, she used to write a column somewhere, and the show House MD was inspired by her column, and she also acted as a medical consultant on the show. William Osler is considered as the father of internal medicine, modern internal medicine, and he said, "We miss more by not seeing than by not knowing." In the introduction itself, it is written, "Crystal's story is every patient's nightmare. To be sick, even dying, and have doctor after doctor fail to figure out why. To be given the wrong diagnosis, or no diagnosis at all, and to be left to the ravages of the disease with nothing more than your own endurance and the doctor's best guess therapy to rely on. To live or die in a modern hospital filled with the promise of treatment, and yet without a diagnosis to guide its use." The next book is this, the big black book, BBB. I'll take out the cover. The Song of the Cell, An Exploration of Medicine and the New Human by Siddharth Mukherjee. Anything by Siddharth Mukherjee is a hit. I love this so much. It is so beautiful. Anything by Siddharth Mukherjee I would describe as captivating and fascinating. That's the way he writes. Because he is fascinated by things, he writes in a way that makes you fascinated by things. Other books of his that I've read and loved are The Gene. It's the storytelling of the DNA and how far we have come in the knowledge of it, and like the story from the very start. And then there's The Emperor of All Maladies, that is cancer. It is the biography of cancer as a disease. Everyone should read Siddharth Mukherjee is what I believe. All of his books are so history focused and storytelling prioritizing that none of his books are about one thing. They are always talking about everything. Very systematically organized, so it's not even all over the place. So this one talks about the evolution of understanding of the concept of the cell as we know it today, spanning many years. So you get to cover many centuries between the covers of just one book. This one has things about history and music and the scientific experiments that they did. The medical experiments, some that failed and many that failed. The understanding of a concept was reached and made and built. The tests that a theory had to face to prove itself true, to have people trust it. This is for anyone who has read and enjoyed his books in the past. This is also for people who have read and enjoyed Yuval Noah Harari's books or talks. Anyone who wants to learn more about cellular biology but who hates their NCERT textbook. Anyone who wants to be sat and told about the understanding and concepts of the medical community by a knowledgeable uncle that they look up to. Anyone who is interested in the crossover between medical sciences and literature, because this is such a beautifully written book. Yeah, the only thing I would say is that this is a big book, so only read if you have the time for it. Part 1 deals with the discovery of the cell. Part 2 deals with the relation of the cell to the whole body. Part 3 deals about the blood aspects. I revisit this section a lot because it has stuff about atherosclerosis, myocardial infarction, CAD, innate immunity, vaccination, AIDS, autoimmune diseases. Each chapter unfolds like a story. You are in a time capsule with Siddharth Mukherjee and he's telling you about everything he knows. His questions become your questions and the answers he finds, he tells you. Somewhere in the book he says, and this resonated with me so much, our lifestyles, lifespans, habits and environments, fat-rich diets, lack of exercise, diabetes, obesity, hypertension and smoking in particular have led in turn to the accumulation of plaques, inflamed, calcified, cholesterol-rich blobs that hang on the walls of the arteries like precarious mounds of debris alongside highways, accidents waiting to happen. Our cardiovascular diseases are just accidents waiting to happen. Yeah, so that's it. That's all I had for today's video. 3 book recommendation. Hope you liked them. Thank you so much for watching. Let me know in the comments down below what kind of videos you would be interested in next.